Now, there are reports that hospital beds in the Western Cape are nearing full capacity. There's also claims that private patients are being moved to state facilities as the coronavirus second wave hits hard. We get into more of that now. We're joined by Dr. Cloete from the Western Cape Health Department. Thank you very much for your time. So we understand that hospitals in the metropole of Cape Town are running at an average 78% occupancy rate, while rural hospitals are sitting at over 90% occupancy. Sounds like a bit of a desperate situation.
Yes, the hospitals in the Western Cape, both private and public, are under severe pressure, and it's mainly because of the rapid rise and increase in COVID cases and the need for hospitalization. The most severe critical shortage is in critical care, that's ICU and high care. And earlier this week, there has been situations where there were virtually no capacity left between the private and public sector for critical care in Cape Town.
So we also understand that patients who do not find space in private facilities are being moved to public facilities. What can you tell us about that?
There are reported instances, and the system that we have is a bed bureau system that we put in place during the first wave. And that's really that we have a daily huddle of our senior clinicians and managers, and they are on top of exactly what the capacity is in every single hospital. So you need to understand how hospitals work. There are people that get discharged daily, and then there are people that get admitted daily. So at any given time, there might be more capacity at one place as opposed to another. And what we've been doing is working closely with our private sector colleagues as well. And in certain instances, when a private sector hospital has no capacity and the nearby state hospital does have capacity, patients have gone that way, but also the other way. So where we have had, which is our critical shortage, which is in critical care, between Cloete and Tygerberg Hospital and the other regional hospitals, we've also transferred people needing critical care to private sector hospitals when that capacity exists.
What is the shortage due to? A lack of beds, a lack of ventilators? What are we talking about exactly?
The shortage is due to an increased demand on the hospitals, not a lack of anything, it's an increased demand. It is exacerbated by this rapid increase in cases of COVID, which now means that more people require hospitalization. That case number is rapidly growing, and you could also understand from yesterday's release, we have some kind of an understanding why it is rapidly growing like that. At the same time of the year, where we have non-COVID work, which we are actively de-escalating, but then the additional factor is alcohol-related trauma. All of that together come onto the healthcare system, and it's really the demand exceeds the capacity that exists. At the same time, while we face all of these, our healthcare workers, like everybody else in the community, also become infected. So the biggest challenge actually is to maintain healthcare services while the healthcare workers themselves become positive and have to be isolated. The ability to find additional healthcare workers, which we are really finding additional healthcare workers. We're trying to bring additional beds online and capacity. We're finding every single person potentially that volunteered to work with us or can be on contract. There's a lot of bursary nurses, which we are busy employing as we speak. We're trying to keep all of this together to be able to cope with what's coming at us. But the pressure is big in terms of the demand coming at the hospital platform.
The pressure is big in terms of demand coming in at the hospital platform. At the same time, the Democratic Alliance has even gone to court to try and get beaches along the garden route open. Given the severity of the situation, what do you make of that challenge?
Just to clarify that everywhere in the province we have this increase in surge of cases. The only exception is the garden route. The garden route has, like Nelson Mandela, has had an earlier increase in cases, and the garden route cases is actually the one place in the province where we've seen some stabilization over the last couple of days. So in terms of garden route hospitals are under pressure, but there's a stabilization of cases in terms of what happens in that area. As far as the beaches are concerned, one of the biggest issues is if beaches are closed, is that people are forced to go into other areas and enclosed spaces. So there are unintended consequences of closing beaches in terms of people congregating then in crowds somewhere else. beaches are open air. It will be a difficulty if the numbers become too big. But in terms of the options that you have and actually getting people to go indoors and congregate and crowd, that's why our biggest appeal is not to crowd anywhere. And the biggest risk for us is indoor crowding. It's crowding in homes, it's crowding in shopping centers, it's crowding in restaurants, in night spots where people come together to congregate. That is the biggest issue that's fueling the transmission of the virus.
Any indication of the Cape Town International Convention Centre being resuscitated as a field hospital?
Not at all. We made it absolutely clear from the outset. We brought 600 beds online in our own existing infrastructure, and we maintained the Brackengate as a field hospital, which has the capacity of 338 beds. What we are doing is we look at all the existing capacity in all our places. So, for instance, Garden Route. Opening the convention centre in Cape Town would not have helped people in Garden Route at all. We opened up 60 additional beds in a TB hospital in George, and that is one of the big reasons why the Garden Route could cope, because they had their own field hospital within the infrastructure of the health department in that place. In the Cape Town, we have this field hospital, Brackengate, and then in addition to that, on the Lenteghy Hospital premises, we have progressively started increasing beds to the tune of 90 beds is available, and over the next 2 weeks, we will bring an additional 200 beds online in that specific facility. Again, it's not the infrastructure that's the rate limiting step, it's the ability to find staff to be able to staff these places.
Thank you very much for your time this afternoon, Dr. Keith Cloete from the Western Cape Health Department.